If you're scrolling on social media right now, good news, you're not addicted. At least that's what the head of Instagram told a judge last week in a trial over whether apps like Instagram and YouTube are designed to keep impressionable users hooked. Welcome back to the Morning Medical Update Weekly Recap with Medical Economics. My name is Austin Luttrell, and these are the top stories in medicine this week. So yeah, the head of Instagram, Adam Mosseri, testified in Los Angeles Superior Court last week that while people can use social media in ways that feel excessive and even problematic, he doesn't believe that constitutes as clinical addiction. The lawsuit claims that social media giants Meta and YouTube downplay safety risks while using features like infinite scroll to encourage compulsive use, which is harmful to young users' mental health. TikTok and Snap were also originally named in the case, but they settled with one of the plaintiffs, so they're out of the trial. That said, the story is far from over. Mark Zuckerberg, the CEO of Meta, and Neil Mohan, the CEO of YouTube, are both due to appear in court in the coming weeks. Next, Dr. Jay Bhattacharya, the director of the NIH, was also just named acting director of the CDC, replacing Jim O'Neill, who President Trump is nominating to lead the National Science Foundation. The plan is for Bhattacharya to hold both jobs until Trump nominates a new CDC director and the Senate signs off, but until then, it's just another shakeup for the nation's health agencies. Finally, we should talk about direct primary care because according to new data from Hint Health, patients are loving it. Using the Person-Centered Primary Care Measure, or the PCPCM, direct primary care scored an overall performance of 89%, with almost perfect marks for patient access and a Net Promoter Score of 85, which that's crazy high for healthcare. There were also some interesting findings, like scores were steady across gender and race, and patients who knew their physicians longer reported even stronger scores. To see how that kind of relationship-based care fits into the bigger question of where independent practice is headed, here's a clip from Medical Economics and Physicians Practice panel. Does independent medical practice have a future?
I think that doctors that are currently in independent practice need to do research, they need to advocate, and they need to promote the benefits of being independent. For example, a lot of people think that DPC or concierge is only for rich people. That's not true. There's a whole lot of Medicaid, Medicare going on, sliding fee schedules. Just be curious and learn about alternative models.
You are so right about that. In this generation, they are smart, they're excited, they care about patients, and it does brighten my day when I get to spend some time with them in my practice. And then I get especially happy when they come in and they say, "Oh, I thought family medicine was just like the hospital clinic, and it's just, you got to see people every 7 to 10 minutes. And I like this. I think I do want to do primary care." There is nothing that gladdens my heart more than to see somebody realize that there are other ways to provide medical care that brings that relationship back.
But that's all for your weekly recap. As always, check back on Tuesday, Wednesday, and Thursday mornings for morning medical updates, and I'll see you back here next Friday with the week's top stories.